Hello students, welcome to the class. In the previous class, we have discussed about the disease called leprosy. Meaning of leprosy, causes for the leprosy, and the preventive measures which have help us to reduce the intensity of the disease leprosy, and which are the available treatment procedures to reduce the leprosy incidents. In this class, we are going to discuss about the disease called H1 and N1. It's also commonly known as swine influenza and swine flu as well as pig flu. It's a respiratory disease that occurs in pigs that is caused by the influenza A virus. Influenza viruses that are normally found in swine are also as swine influenza viruses. The known swine influenza viruses strains include influenza C and the subtype of influenza A known as H1N1, H1N2, H3N1, H3N2 and H2N3. Pig can also become infected with the H4N6 and H9N2 subtype. These are the various types of H1N1 influenza which are caused by pigs. Swine influenza virus is common throughout a pig populations worldwide. Transmission of the virus from pigs to human is not common and does not always lead to the human influenza, often resulting only in the production of antibodies in the blood. If the transmission does cause human influenza, is called zoonotic swine flu or variant virus. People with regular exposure to pigs are at increased risk of swine flu infection. Properly cooking the meat of an infected animal removes the risk of infection. Properly cooking procedures may reduce the risk factors while we are using the pig meat or pork. H1N1 influenza is a contagious respiratory disease that causes symptoms of seasonal influenza in people. Person to person transmission of H1N1 flu virus occurs and the virus is easily spread among the people because it's a respiratory disease or respiratory transmittable. H1N1 flu virus is made up of genes from several different flu viruses that normally circulate among pigs, birds and humans. Most commonly, those who are using the pork and as well as the bird meat, they are highly risky to having the H1N1 virus. A person infected with H1N1 virus can infect other starting one day before symptoms develop and up to 7 or more days after becoming ill. A person is infected with H1N1 virus can infect the others starting one day before symptoms develop and upon 7 or more days after becoming ill. This is the risk factor how the H1N1 virus can spread easily from one person to another person. H1N1 is spread from person to person when the virus enters the body through the eyes, nose and mouth. Coughing and sneezing releases the germs into the air where they can be breathed by others. The stains which are having the virus H1N1 virus may be inhaled by the persons or healthy persons, may cause or have the high risk factors having the H1N1 disease. The virus can also rest on hard surface of door knobs, ATM bottoms and counters. A person who touches these surfaces with their hands and then touches their eyes, mouth or nose can become infected with this virus. It's just like a novel corona which is spread through air and the materials where the infected persons may touch with the stains, sneezes. It may increases the risk of contaminating. Then what is the symptoms of H1N1? Body aches, chills, cough, fatigue, fever and then headache, loss of appetite, sore throat. Some people with H1N1 virus have also reported vomiting and diarrhea. These are the symptoms of H1N1. These are common to the coronavirus also. Then most of the symptoms are commonly symptoms become the symptoms of many other diseases also. But proper diagnosis only can predict or identify the H1N1 disease. What is the preventive measures of H1N1? It can be prevented through avoiding close contact with the people who are sick and who have symptoms of H1N1 flu. We have to avoid the contact of the persons those who are already infected by H1N1 virus. Infected should stay at home when he or she is sick. The persons those who are infected with the H1N1 virus should not go to the outside, but because when they are go to the outside or traveling, they may have the they may carry the pathogens and spread the disease unknowingly. Because of that, they have, when they get infected by the H1N1, they have to stay at home only. Stay at least 1 meter away from the people. Rest of and drink plenty of fluids. Cover the mouth and nose when coughing or sneezing. Frequently wash the hands thoroughly. Use of alcohol based on hand sanitizer. If you don't have access to that sanitizer, then soap and water is best one to clean your water or maintain the best sanitation process. Then what is the treatment for H1N1? Vaccination should given for H1N1. There are also medications available to help the people to prevent the H1N1 virus and spread of H1N1 virus. Treatment of H1N1 flu, they are called antiviral medications. There are two classes available, M2 and neuraminidase inhibitors. These are the medicines which are available to get the treatment for H1N1 virus. There is no proper medicine for H1N1 or novel corona. If we want to make our health, if we want to maintain our good health, we have to maintain proper sanitation, proper sanitization, good habits, and avoid stay away from the home while we are infected with the virus. These are the things we keep in our mind. Being a person, being a responsible citizen, we are not supposed to spread the diseases. Hope you understand properly. Thank you for listening. We will move to the